Morning, everyone. Welcome to today's webinar, the Reexamining the Opioid Crisis, a Year in Review. It's hard to believe that we're already in December, but excited for today's webinar and excited for our expert faculty that I'll introduce in a minute. Before I do that, some housekeeping. Today's webinar is designated for one AMA PRA Category 1 credit, one ANCC contact hour, one ACPE contact hour, one AAPA Category 1 CME credit, and one ADA CERP continuing education credit by the American Academy of CME Inc. And for any pharmacist claiming credit, please note that your credit will be uploaded to CPE Monitor within 30 days. This webinar has also been approved by NJOEMS for one EMT elective CEU. And the Partnership for a Drug Free New Jersey is approved by the Board of Certification, Inc. to provide continuing education credit to athletic trainers. And this program is eligible for a maximum of one Category A, hour, or CEU. Our speaker today, Captain Jason Piotrowski, discloses that he is a former shareholder of Merck and Mind Medicine. Our PA planner, Dean Barone, discloses that he serves on the Speakers Bureau of Ethicon and Johnson & Johnson, and all other planners, faculty, and reviewers have no relevant financial relationships to disclose, and all relevant financial relationships have been mitigated. If you wish to claim CME or CE credit for today's webinar, you must do so within 30 days from today's date. After that time, we will no longer be able to issue you credit, and there'll be information at the end of the webinar on how to collect that credit. Today's webinar is jointly provided by the Partnership for a Drug Free New Jersey and the American Academy of CME Inc. and is being held in collaboration with NJ Cares, the Office of Alternative and Community Responses, the New Jersey Office of the Attorney General, and the Opioid Education Foundation of America. And once again, I thank them for their partnership, support, and collaboration on today's learning activity and throughout this entire year-long series, and as we move forward into 2026. So I thank them for their support. I thank all of you also for continuing to join us for these important conversations. But I am now so pleased to welcome today's expert faculty. For those of you who have participated in webinars in the past, he's a familiar face. We're welcoming Captain Jason Piotrowski from the New Jersey State Police. He's the executive officer in the Forensic and Technical Services section. Captain Piotrowski, welcome, and thank you so much for being with us today. Oh, I can't hear you, Jason. I think you're still muted.
Yep.
There you go.
Of course I was. Yeah. Thank you very much, Angela. I really appreciate being given this opportunity and all the great work you guys do over there at Drug Free New Jersey.
Thanks.
All right, so I'll get started right away on what we're going to be covering here. So we're going to talk about the national landscape, the cost of the overdose epidemic, the state of New Jersey drug environment, fatal, non-fatal overdoses, demographic overviews of those overdoses, fentanyl and the other opioids that are out there, adulterants in the opioid supply, prescription and seized pills, stimulant trends, what's going on in the retail market right now with kratom and the intoxicating hemp products related to the Agricultural Improvement Act of 2018. That's been in the news a lot lately. I'll talk about that. I'm going to talk about drug recognition expert evaluation trends, treatment trends, and I'm going to wrap up with what New Jersey's done over the years to combat drug harm. So moving right in, a lot of the data, and I will do my best here to give you the details of the data. It's clearly marked on the slides, but I pulled the most recent data as of even a few days ago, and the most recent published data. So, but it varies whether I'm looking at the CDC, whether I'm looking at state police, or wherever I'm pulling the data from. So it does vary, but it's the most recent data that's available. So starting with the top 15 leading causes of death of all ages in the United States. This is, again, from the CDC, and that's the most recent data they had from 2018 to 25. The disease of the heart, one leading cause of death, followed by malignant neoplasms, which is cancer, and then accidents highlighted there, unintentional injuries. That's where we're going to talk about poisonings and overdoses. That's the category that falls into. So it's the number 3 leading cause of death there. There's other accidents in there, motor vehicle accidents and things like that, but the lion's share of those accidents are the drug poisonings. And just take note of that number there, nationwide, 54.9 per 100,000, because I'll show jerseys later and you'll see how we compare to the national averages. And so CDC unintentional injuries, this is for 2023, and you can see it there for the National Vital Statistics System mortality data 2023 from CDC Wonder. There were 222,000 unintentional injury deaths. Unintentional poisonings were 100,000, and motor vehicle traffic deaths were 43,000. There was a time when motor vehicle traffic deaths were more than the poisoning deaths, and you can see it's more than double now for the unintentional poisonings. And you look at on the right there, again, you see how many drug overdose deaths, 105,000, and any opioid, 79,000, and then the synthetic opioids, which is where fentanyl is going to come into, that's 72,000 of that, about 100,000 drug poisoning deaths. Sorry about that. And then we move here to this includes 2024 provisional data, so it's a little bit more updated. So it's 2018 through 2024 provisional data, and you can see how many deaths there have been across the country: 676,000 during that time period for drug-induced causes. So closing in on tragically on 1 million people across the country during that period. CDC overdose deaths provisional data. So I present these all the time, and just to see where we're at. And you can see what the CDC does is they show the last 12-month period. So the chart on the left there is going to be from February 23 to January 2024. And you can look, the blue there shows decreases, and the orange color there shows increases. And so we're going to go through this for a few slides, and you'll see how the East Coast of the country was making progress before the West Coast. And it really kind of started on the East Coast, and so it ended sooner on the East Coast as well. We move forward a few months to the 12-month period ending 2024, April 2024. And you can see there's a little more blue and less orange. And the percent change for the United States during that time was down 10%. And then moving forward a few months later, even less orange. So again, the epidemic was the overdose epidemic was decreasing in magnitude there across the country. And I did a call out box there too. So the country's down 21.7%. New Jersey at that time was down 30%. So we were, obviously outpacing the rest of the country. And that's something that, is I'll continue to talk about here. And then finally, the last reporting period was the 12-month period ending April 2025. The country's now down 24.5%, and we were down again over 30% during that 12-month period. I'm going to talk about the deaths and injury costs, and I just want to explain to you why I'm going to talk about it before I get into it. And why I'm going to talk about it is because if you're on this call, you're invested in this topic, you care about this topic because you care about public health, you care about people, you care about your communities. But we also have to get support to continue to make progress on this. And so whether you're talking to legislators or you're talking making justifications for grants, the fiscal aspect can come in handy there. It's just a strategy and a tool. And so what we're looking, this is 2019 to 2023. And the top 5 causes of injury and death for for all persons, it's all age groups there. It's 31.6% is the unintentional poisonings. And the total injury cost is 4.89 trillion. And I'll tell you where they come up with that in a minute. And the fatal injury cost is 2.91 trillion. So you see in the middle of the chart there towards the bottom, years of potential life lost before the age of 65. And that's how they kind of calculate those numbers. It's some complicated formulas, but essentially they put a life expectancy on everybody, and then they subtract based upon when each person was lost. And so the average there is 26.34 years. Now, I don't expect anyone to be able to read the chart on the left, but I just wanted to show it as an illustration there. That's all the injuries and associated costs. So it's going to have things on there like motor vehicle accidents, firearms, drownings, falls, and obviously unintentional drug poisonings. So the thing to note there of all those numbers, there's only one T on that chart and representing trillion, and it's the 97,000 deaths in 20. This is just 2023, and the total medical costs were 741 million, and the value of statistical life there, which I just talked about, is 1.1 trillion. Now they do break it down for this data set in New Jersey. So again, 2023, tragically we lost almost 2,600 people, and the medical costs there were 200 and or I'm sorry, $20 million, and the value of statistical life they put on that for the state of New Jersey was 200 or I'm sorry, $29 billion there. So again, when you're talking and trying to make justifications for things like harm reduction, treatment, and obviously prevention, there is a return on investment for your initiatives that you can show and you can express when you're making your justifications for why your programs are so important. Now, this is non-fatal hospitalizations is on the chart there on top, and on the bottom it's non-fatal. So again, these are just overdoses where people were treated and released. And for those, we're looking at hospitalizations in 2023, 344,000 with a medical cost there of $10 billion. And then treatment and released at an ED, you're looking at 1.31 million in 2023 and medical costs of $12 billion. And they didn't have New Jersey specific data for these two categories. So now here's another chart showing it's kind of similar to the charts we saw before, but it's from the same place, and it's the CDC drug overdose deaths provisional data, and it's that data was based on data available for analysis on September 7th of 2025, and you can see where the country has gone up, and peaking, 23, towards 24 there, and then on the downturn, and it's been on the downturn ever since. And now this is New Jersey's. And again, we peaked earlier. And then let me go on to the next chart here where it shows side by side. The way I look at this is, in 2018 to 2023, we remained relatively flat versus the rest of the country was still kind of on the upward trend. And the way I like to think about that is if you remember, with COVID in March 2020, the mantra was 2 weeks to flatten the curve. I feel like we did that in New Jersey pretty well. That curve, stayed pretty flat for a few years. And then we'll talk about why it's went down both in New Jersey and nationally, but certainly it speaks to kind of all the work in New Jersey. And I have a lot of visibility about around the country, and we've always been kind of ahead of the curve. Former Attorney General John Hoffman was very passionate about this issue, and he put forward the Overdose Prevention Act in 2013, 2014, and allowed police officers to carry naloxone. We were pretty far ahead of the curve on that, and you can see how many naloxone administrations have been administered by police over the years. EMT and paramedics, they do for first responders, they do about 2/3 to public safety, and law enforcement do about 1/3. But certainly getting those naloxone in the hands of police officers as first responders, I think, and all the harm reduction work that's been done out there, and the prevention and the treatment and everything else that we were so proactive in, we really flattened that curve out pretty good starting in 2018. So now I told you to remember that 54 number. Again, now this is the top 15 leading causes of death of all ages, and this is just New Jersey. So again, the country's at about 54 or 55 per 100,000. We're at 43. So we're doing a little bit better than the rest of the country there as far as that's concerned. This chart here, and a lot of these charts here, they come from the New Jersey State Police Drug Monitoring Initiative. For many years, Betty Stana, Brian O'Leary have been doing a great job of capturing all this drug-related data and making these charts. The data comes from the Office of the Chief State Medical Examiner in New Jersey. Now, what's really cool here, this goes back to 2012, and I've been doing these for a long time, and a lot of times I didn't have good news, and I had bad news where things were going up. But you can see there, we're projected to about 1,068 this year, which again, one is too many. We all know that. But we're looking at two less than we saw going back to 2012. That's as far back as we report this data. So again, just tremendous progress in the state of New Jersey. And if you go back to 2012, that's kind of the oxycodone to heroin time. And we're getting below those numbers now, which is amazing. This is the last 3 years, and this is the monthly averages of drug-related deaths in New Jersey. And you can just see, again, it's just another illustration about how far down the drug-related deaths have gone. August of this year was a really good month in that context, where there was only 65, and May has always been historically a pretty high month, April, May, but for whatever reason. But you can see how far down it's going, over the years, just in the last 3 years. And again, I mentioned we started coming down before the rest of the country, and you can really see that here. Now, again, I know everyone on this call is from all different places, so this is going to show each county and where your county falls, with this data and the kind of the progress you're making in your respective counties. And you can see there that's the monthly averages of overdose deaths per county by year going back to 2012. And again, the numbers are getting pretty low here in many places, and even in places where they're higher. Essex County, 13 is the average in 2025. That's 50% less than last year. Where they had 26 average last year. So again, the progress is being made everywhere, and it's really encouraging. And now this is going to, again, State Chief Medical Examiner drug-related death data. This is looking at just this year, and it's through October 31st. And you can see in your particular county, which months were higher, which months were lower. You can look at your monthly average and your monthly highest and monthly lowest. And again, I know you know this. Most likely these slides will be available through Drug Free New Jersey. They'll be posted on YouTube, so you'll be able to view these at your leisure and dig into these a little more. Now, this is looking at, it's almost the same time frame, January to September 2023 to January, September 2024 on the left. It's a little bit different. It's January to October 2024 and January to October 2025 on the right. So last year when we looked at this, there were still some counties in the red, but now all the counties are in the green. And during that time frame, we're down 44%, the state is, from that time frame last year to this year. So again, just continuing to make great progress here in New Jersey. I told you I was going to dig into the demographic data, and this goes back now. And you're looking at who are the most afflicted populations. So again, we're making great progress, but we want to make sure we're continuing to make that progress, and where we're going to be most impactful doing that. And again, if the state average, the crude rate there is 43. For Black African American between 55 and 64, it's 112. It's not quite 3 times that, but almost 3 times that. So again, that's the most afflicted population right now, and probably the population that, from strictly a statistical standpoint, kind of bears and needs the most attention, is the way I would look at that. And the second one there is Black and African American 45 to 54 at 86 per 100,000. And then followed by white people from 35 to 44 at 60. And then again, older Black and African American 65 to 74 is the fourth category there. So your three of your top four categories are going to be the Black and African American community. And again, we're looking at from 45 and up, and that's the age range that really kind of is the most afflicted right now. So now looking at naloxone data, that's highly correlated, obviously, with overdose data. And again, I said we collect all this naloxone data. We have a great relationship with our Department of Health, and we have pretty ironclad data use agreements, HIPAA protected. The data they send us and the data we send them is case information protected. So no PII or anything like that. Strictly just numbers and incidents. And you look at the projected totals this year. We have about 3,200 for LE, down a little bit from last year. But the EMS will be about 7,500 this year as well, projected out if you project out those 2025 numbers. Because again, that's not that's only through September 30th this year. So there's your projected totals there on the bottom. And that's not projected. It's projected based strictly on the averages. So it could be lower or it could be higher, but strictly on the averages for the first 9 months of the year. That's how we projected that out. And so the chart on the right, I presented this before. I really like this one. And that represents when law enforcement responded to the scene of an overdose, was naloxone already administered? So you have first responders going out there. In this case, it's the police officers because that's the data we have. And 18% of the time there in 2024, naloxone was already administered by a layperson, by someone in the community. And I think that's just very telling. And it's very, whether it's the policies of leave behind naloxone kits, all the harm reduction work that's being done out there. And again, if about 20% of the time someone has already administered naloxone, that's amazing, before first responders even got there. And I have a little star there. It's likely underreported. So what I mean by that is whether the police officer marked that on the naloxone report, whether he knew, or whether they were never even called because it was handled, by the people in the community, and they might not have even called. So it's likely much higher than that. And well, I don't want to say much higher, but it's likely higher than that. I don't know exactly how much higher it would be, obviously, but it's really a testament to all the harm reduction work that's being done out there. So naloxone administrations, and this is LE and EMS by county, and you can see which counties are administering the most naloxone out there, and it again just speaks to the populations that are the most afflicted out there right now in the area. So we talked about the people, we'll talk about the places as well. So and we'll also talk about the time there. And if you look at that, 1 to 4 and 5 to 8 p.m. is the time when naloxone administrations are mostly administered. And you look at the days of the week there, Thursday is the day where naloxone is most administered, followed by closely by Friday. And so, when I look at that, talk about resource allocation, when you want to have, people on duty responding, people with naloxone, or when you want to reach out to clients and things like that. And when you want to be most proactive, you can use that and say like, okay, well, we know when our peak times are going to be, we know when our peak days are going to be, where we really want to make sure we're engaged in those times to be the most impactful we can be to keep driving these numbers down. Another look at demographic data, again, this time from, naloxone. Again, that 55 and older population is very high, followed by the 35 to 44 population. And, 75% of naloxone administrations involve subjects 35 and older. So again, it's really, the older population. I think there's been so much work that's been done making the younger generation aware of this. And, whether it's the DEA's One Pill Can Kill program or the Drug Free New Jersey programs and all the work that's been done and all the media campaigns that have been done, I really think that we're getting a lot less people start with opioids, and you'll see that with the prescription data too. There's so much less being prescribed now. I'll show that later. And then, so is it male or female? And this is always very consistent: 71% male to 27% female, with 2% unreported there. And you can look at those percentages now as well. There, and again, that 55 and older population at 36%. We'll look at it a little bit different way. So now this is doing the age. On the left is doing your age and race. And again, so 55 and older, Black and African American, and is the number one category there, followed by 55 and older white people as well. And again, for resource allocation and understanding the most afflicted demographics, it's really important. And the chart on the right there, again, we're looking at now race and gender. So again, there's a lot of ways to like kind of slice and dice this data. And you're seeing that, the most afflicted population here. And understand too that the Black and African American population in New Jersey is roughly 13 to 15%, depending on what census data you look at. But so again, disproportionately affected. 800 and Black males represent 837 of those naloxone administrations, the highest number you'll see there. All right, so I'll talk a little bit more about the drugs now. And this is drug seizure data. So this is what all the forensic labs in New Jersey, what they are, just checking my time here, what they are seizing, and goes to the forensic labs, and it gets tested through the scientific equipment. And you can see there was in 2020 is an anomaly because that was COVID, and a lot of that, the arrests were down, and a lot of the seizures were obviously down. So when you look at any of these charts and any of this information, always keep in mind 2020 was an odd year. But in 2021, almost a million bags were seized. Well, not that close, 726,000 from almost 10,000 cases. And we're looking down now this year, it's 231,000 is the projected total. What's interesting about that too is there's so much work being done targeting opioids, opioid enforcement task force in New Jersey, and so many resources going to it, and they're just not finding it as much as they used to. So the historical impact of fentanyl, we saw that chart from the CDC before, 2023, synthetic opioids, fentanyl, primarily was the leading cause of death there. And you can see this chart only goes to 2023. You can see that green line there representing the synthetic opioids and how it climbed very dramatically starting in I guess 2013. It started climbing dramatically. Again, back to another CDC chart here. And this is the drug overdose deaths by drug or drug class in the United States on the left, and then specifically in New Jersey on the right. Again, New Jersey has that. They show there in New Jersey from January 2019 to January 2024. You can see that you can see it was really flat for all those years, and then that big decline there in 2024. And I have fentanyl depletion there. We'll talk about why that is. So these next few slides, again, I'm the executive officer over at Forensic and Technical Services section. So, all the forensic science data that we have, and this is showing what the report that the scientists will see there, and it's showing a spike there in heroin. So now think about this is probably 2012-ish. That's what you would see in a sample, and that really high spike there. And then moving forward, you see that fentanyl now enters the picture, and with tramadol as well. But fentanyl now enters the picture, but it's still heroin. And then the chart on the right there is showing how fentanyl kind of took over, and heroin goes down. And then moving forward, we start to see fentanyl going down and their peaks going down, and xylazine was a very high peak there. And now moving forward to the last one I have here to present. And again, it's just an illustration. Um, you have xylazine, procaine, lidocaine, fentanyl, bromazolam, which is a benzodiazepine, very potent benzodiazepine. But you just see there, again, it's for illustrative purposes, all the different drugs that they see in the drug environment now. And and that's a sample of drugs that was seized that was suspected opioids and tested by a forensic scientist, and that's what they saw. So there's all these different drugs in the mixture now. So again, what's the current fentanyl outlook in New Jersey? So the supply indicators, there's a lower fentanyl ratio in forensic testing, right? It's reportedly harder to find fentanyl now, and I presented on this last year. All over the country, researchers were all saying the same thing, that fentanyl is becoming harder and harder to find, and drug samples are increasingly containing multiple drugs and other drugs and a lot less potent drugs as well. So all those decreases that we see across the country. It's not just anything that's being done here in New Jersey. It's really the supply. Fentanyl's been depleted, and again, I did talk about this last year. The cartels have been moving away from fentanyl for various reasons. Demand indicators: opioid seizures are down, stimulant seizures are up. I'll show that in a minute. And less people are utilizing treatment. When I talk about the treatment numbers, I'll show from the data that Rutgers collects with partnership with Department of Human Services and in the treatment data. Less people are utilizing treatment for opioids than in years past. So again, I think there's a lot less people using opioids now than used to. I think that and the cartels aren't pushing it and supplying it like they used to. So again, other indicators nationwide, including New Jersey, overdose deaths are decreasing, and fentanyl related deaths are decreasing as well. So the current outlook there, it hasn't changed much over the last year. The drug market transition from being primarily demand driven to supply driven over the last couple of decades. It used to always be supply driven. If you wanted cocaine, you got cocaine. If you wanted heroin, you got heroin. But the cartels really, the two major cartels, kind of really consolidated the drug environment there, and they kind of decide what you're getting. You don't even know what you're getting. Oftentimes, there's many drugs in those samples, and many indicators again point to a decreased fentanyl supply, and it's hopeful that this is going to persist, but remains unknown. So, if these cartels are displaced, what are the implications for that? Because they kind of put a stranglehold on fentanyl, if you will, and they don't want it produced anymore. They don't want the attention and the negative attention that they were getting from it. So, but if they were not policing it themselves, there's potential for others to try and fill the void. Fentanyl is very lucrative. It's very easy to produce. Can make a lot of money off of it, but the demand's also decreasing as well. So it's likely, but never definitive, that the fentanyl-related overdoses are going to continue to decrease. And that has to do with effective policies, prevention successes, treatment successes, harm reduction, and all the great work that's being done there, and certainly federal government intervention. Um, the that was something that the cartels had communicated, that they were worried that the U.S. government was going to take action. This is going back. It was a Wall Street Journal article in 2023 that came out that the cartels wanted to, at least one of the cartels wanted to get out of the fentanyl business because they were worried about the U.S. government taking them on. So now adulterants in the drug supply. So again, I showed that on the mass spectrometer reports there, the scientific equipment. In Q3 of 2025, so pretty recent data, one drug in that sample was 5% of the time. And this isn't the suspected, it says suspected heroin. That's just how the statutes are written. And so police officers submit the reports using the vernacular in the criminal code as suspected heroin, but they know it's not heroin. Poly drug, 95% of the time. So 2 to 4 drugs, 46% of the time, 5 to 7 drugs, 34% of the time, and 8+ drugs in that one sample, 15% of the time. And now you look back, It's broken down a little bit differently to 5+ drugs there on the chart on the right. In 2015, 2016, 2017, we never saw that. And now that's 54% of the time. So xylazine was, we kind of showed this. This came into New Jersey, and it was, it took over the drug supply for, if you will, a lot more xylazine than fentanyl was in there. And you can see just how robust it was, over the years. But Medetomidine is the same drug class, and it's very similar, except it's more potent. With Medetomidine, the fear was that just like, you know, the opioid environment started with morphine, then to Oxycontin, then to oxycodone, then to heroin, then to fentanyl, that xylazine was the least potent, and then there were potential replacements in the drug supply, medetomidine being one of them. And, some of the federal agencies, the three-letter agencies were pushing out that, like, we're worried that they're going to move to these more potent substances like they had with the other drug classes. And they did that with medetomidine. So this was a report that from the Center of Forensic Science and Research put out in May of 2024, a public health alert. They were seeing medetomidine. You can see there where they were seeing it, and obviously that the circle there in New Jersey. Well, really, I think that represents Philadelphia, but what happens in Philadelphia is going to happen in New Jersey too, and it does, and it has. So if you look here, this is the medetomidine. So xylazine's kind of on its way out, and the more potent medetomidine is on its way in. So when I was showing those naloxone numbers, and you were seeing they're not going down as dramatically as the overdose are, because people are still overdosing now more on, because medetomidine is so much more potent. With that, you don't get with the xylazine what a lot of people were getting. They were getting the serious bacterial infections, the SBIs, causing necrosis and skin ulcers and things like that. You don't get that as much, but the overdoses with medetomidine, again, it's more potent, and so you're going to have more of those acute, overdose incidents, or those acute reactions of, becoming overdose incidents. All right, so prescription trends here in New Jersey. So this is from our Consumer Affairs and New Jersey Prescription Monitoring Program. And again, this speaks to policy, this speaks to the 5-day rule, and this speaks to prevention and media campaigns and everything else. Opioid prescription dispensations were almost 6 million in 2015. And again, when people start with that, and they develop a physical dependence, and they develop an addiction, and that leads into these other drugs like heroin and fentanyl and things like that. So, but you can see the that data is good as of November 17th, 2025, there for the last bar on the chart there. But they've gone down significantly over the years. So again, less initiates is what we would say into the opioid environment. Less people using opioids, less people starting on opioids. And I think that's had an impact as well. So seized pills. Now this is different. This is what law enforcement is seizing and sending to the forensic labs throughout the state. And what are these? What are in these pills? So you can see, fentanyl-related pills, in 2023 were 37%, and so they were pills that looked like oxycodone, but were containing fentanyl and were much more potent than oxycodone. So if someone, and over the years, when they first started doing these counterfeit pills, they didn't look very good. You could tell they were not prescription grade, not from a legitimate pharmacy, but now they've gotten really good, and they're really hard to detect. They look like real pills now. They've gotten much better at producing these pills. And so again, you see there in 2025, you see a lot of methamphetamine in these pills. We'll talk about the stimulants in a second. And here's another chart here showing the New Jersey drug environment that sees pills. And this is just pills containing fentanyl. And again, Sometimes it's just fentanyl, and in other times there's multiple substances in there. You see carfentanil in there, which is much more potent than fentanyl, but again, very dangerous. And we've seen people who have even thought they were getting a fentanyl pill and really got carfentanil and overdosed. But again, this is just showing what the fentanyl pills look like here in New Jersey that we're seizing. Because again, that was a big category, and we're just breaking that down and showing that. So cocaine. Again, I said that the stimulants were on the rise, and they're on the rise. Both, again, law enforcement has been traditionally over the last 7 years looking for more opioids, obviously because of the harm they cause, and but you see that the projected year-end totals here for 2025, the cases is probably the more important number. The specimens that could be impacted by one large seizure or two large seizures. You could get a lot of them, but how many cases are actually out there? We're going to top 6,000 this year, and that's the biggest number we've seen in several years. The chart to the right there, that's real historical data. So it goes back to 2015, and the cases were at about 3,000, and now they're going to be over 6,000. So again, from 2015 to 2025, we're looking at 112% increase in cocaine cases here in the forensic labs. Methamphetamine, that's been a much bigger increase. Again, the chart there, the bottom chart on the right, I'm just showing that for illustrative purposes. Where we were in 2015, we had 203 cases. In 2025, we're projecting out for over 2,000 cases. That's a 924% increase over that period of time. So again, methamphetamine is really on the upturn. It's not quite at the level of cocaine, but it's rising. It's been rising for several years there, pretty dramatically. So now I want to talk about the retail market a little bit because this is something that we need to be concerned with, and something that's out there all the time. Convenience stores, it's not scheduled, is this kratom. And so this is a DEA drug fact sheet about kratom, and it has two major psychoactive ingredients. At low doses, it produces stimulant effects, and at high doses, it produces sedative effects. Can lead to addiction. I don't like to read much on the slides, but I don't really have much of a choice for these next couple slides. I want to socialize this with you all and give you this information. So several cases of psychosis resulting from use of kratom have been reported. Individuals addicted to kratom exhibited psychotic symptoms, including hallucinations, delusion, confusion, nausea, itching, sweating, dry mouth, constipation, tachycardia. And now this is from the FDA. I try to give different sources here, CDC, law enforcement, FDA, DEA. An estimated 1.7 million Americans aged 12 and older used kratom in 2021, according to SAMHSA. And so 7-hydroxymitragine and 7-OH is one of the components in kratom. It's one of the psychoactive substances. It demonstrates greater mu opioid receptor potency than kratom's primary alkaloid, the mitragine. So the 7-OH, it's a little more receptive to the receptors there, as well as other classical opioids such as morphine. So what are they saying on here? Again, risk of serious adverse events, including liver toxicity, seizures, and substance use disorder. Rare cases, deaths have been associated with kratom use, as confirmed by medical examiner toxicology reports. But so it's hard to narrow down to, because that's usually, you see there's usually in combination with other drugs. So it's really hard to kind of narrow it down, but they're seeing it involved in by medical examiners, they're seeing it involved in the drug deaths. So kratom-related substance use disorder, people met the criteria for that, using kratom for longer than intended, more kratom than intended, cravings, and continuing use despite adverse consequences. So again, all the criteria for addiction. FDA is also aware of cases of neonatal abstinence syndrome, so jitteriness, irritability, muscle stiffness following prolonged exposure to kratom prior to birth. And again, this is widely available everywhere. I've I'll drive down the road and I'll see, you know, neon signs, kratom available, in convenience stores and other places. All right. So the again with the retail market here, the Agricultural Impact Act, otherwise known as the Farm Bill of 2018, what they did for the first time is they carved out hemp, and they said if it comes out of the ground at 0.3% or less THC, these hemp plants, that it can be used, and it won't fall under Delta 9 THC illegal criteria. But what's happened is it's the number I've seen, in several reports is a $28 billion industry. Um, they take that 0.3% or less hemp plant and of Delta 9 THC, and they extract it all out, and then they put it in products and they sell it. And so they're kind of calling it the gray market. And you can see in October, Governor DeWine of Ohio declared a state of emergency in reference to this, and it's being challenged legally um, there by people who are in that business of the Delta 9 and in the products that are being sold out there in the retail market. So we all do this, right? You go to Google and so you can see what I did there. How much THC is good for beginners? And it's saying 1.25 milligrams is suitable microdose for those new to cannabis. 2.5 to 5 is a moderate dose that can provide noticeable effects without being too intense. And then is 10 milligrams too much for a beginner? And you'll see why I asked that question in a second. And yes, it can be considered too much for a beginner. Intense effects of THC can produce strong psychoactive effects such as euphoria, anxiety, paranoia, which may be overwhelming for beginners. So why did I key in on that 10 milligram number? So this is from a local liquor store here in New Jersey, and the banner on the top reads, Delta 9 section. So you have all these different drinks out there, and some of them have like 10 milligrams per seltzer. So again, is 10 milligrams too much for a beginner? Well, you're going to get that in one drink and one seltzer. That one on the right there looks kind of like a wine bottle. That's 10 milligrams per serving, 17 servings. So that bottle's 170 milligrams of THC in it. And again, now that it's in kind of every liquor store out there, it just becomes readily available. And a lot of people don't really know their tolerance, and especially if they're new to it, it can be problematic. So again, they're calling it the gray market. Now, this was also part of the government shutdown that just happened and the continuing resolution. This was part of that. And what they did was, checking my time again, what they did was they addressed this. They addressed the hemp portion of the farm bill. And so they said, all right, and we're going to amend this. You have in 1 year, it's going to be amended. So this is going to be the status quo until November 26th of next year. All these products should still be available in the way they're available now. Other states like Maryland, they won't allow this. And what they did is said, no, you're not selling this in convenience stores. You're not selling this in liquor stores. If it's Delta 9, it has to go through the dispensaries, and that's being challenged legally in Maryland. So states that are trying to kind of control this are all being challenged legally, by different organizations that are invested in the hemp business and this business. Again, it's a $28 billion business. So cannabis and driving from the CDC, driving under the influence are not just for alcohol. Cannabis is the most commonly used drug that is illegal at the federal level in the United States. And, after alcohol, cannabis is a substance most often associated with impaired driving, slow your reaction time and ability to make decisions, impairing coordination and distorting perception. And so why I bring that up? So drug recognition expert evaluations. So police officers, when they pull someone over and who are exhibiting signs of driving impaired, what they'll do is, if they're not detecting alcohol, but they believe the person's impaired, they'll bring them back to the station for driving under the influence of a substance, and they'll call out a drug recognition expert. And these experts they're police officers, and they go through a pretty robust training in detecting what the person is under the influence of. The whole program was challenged legally. It was a big case in New Jersey. And what they found was that 91 and 95% accurate. So what they did was that what a police officer said the person was under the influence of, and then if there was chemical analysis, toxicology, whatever, followed up by if they drew blood, they took urine, whatever, they were right between 91 and 95% of the time. That's what they found in the legal challenges. So they're highly accurate. And you can look at this. So cannabis there on the bottom there, 27%. Used to be narcotic was kind of the number one category there over the years. And now cannabis is right up there with it in 2025 now. And again, that's partial data for 2025, but it's a significant number of the time now, and right on par with narcotics. When people pull someone over under the influence of something other than alcohol, driving impaired, they're finding cannabis more and more often comparative to the other drug categories. So the treatment trends here, and this is a cross section. So it's January of June, and I did it every 3 years from 2012 to 2024. And what I highlighted there was that alcohol is increasing, and the heroin is decreasing. So these are people who are seeking treatment, and over the years. And now I pulled January to June of 2025. Alcohol is still increasing, and heroin is still decreasing. So what I bolded there was the cocaine and crack, and we talked about the stimulants being up and kind of opioids and fentanyl being down, and you're seeing the stimulants. More people are seeking treatment for cocaine and crack now than they ever have in the past. Going back to again 2012, you see it increased up to 8.8% in 2024. It's up to 9.6% now in 2025. So I'm going to, end here. And New Jersey efforts to reduce drug harm. They've done so much here in New Jersey, been very proactive. So Governor Murphy allocated 95 million for opioid recovery and remediation fund. Human Services, Governor Murphy announces 25 million in additional opioid response initiatives. You can see all these different milestones that all the different departments in New Jersey have done to kind of combat this and support all these programs that are out there. Naloxone saturation is a big one. I talked about that, and I put that chart back up there again on the left of how often naloxone is seen and administered by community members. And the New Jersey State Police Operation Rise, a program that I was on the ground floor was starting. They've administered 480,000 naloxone doses. There's 2 doses per kit, but since they started a couple of years ago. So there's just a ton of naloxone out there. There's a ton of work being done. And again, we've seen a lot of progress here in New Jersey, and I just hope we can keep it up and drive those numbers down. And that is all I have for today.
Thanks so much. I think that was a lot of great information. I think that is really helpful in all of the work that we do and all of our attendees. So thank you for sharing that. We're go to have time for a few questions. I know a poll has launched, and so thank you for everybody who can give us your feedback on that. But Jason, one thing that you talked about that we got a lot of feedback on in Q&A was the demographic data, and you talked about peak days and peak times where you were seeing overdose, and so is there any other data that's collected about the older African American population with the higher numbers that you mentioned? Any other information? Are they people who are longtime users, or are there other circumstances? Is that something that you guys collect or have information on?
So I'll speak kind of more anecdotally on that. And when the overdose epidemic started with kind of oxycodone and into heroin, that was generally kind of the white population were the peak numbers early on. And then you see it, transition over time. And, there was a time when it turned over to be the Black population became more afflicted. And again, anecdotally, there are, many cases where you see, again, stimulants being adulterated with fentanyl. And that's, again, real problematic because, and it could lead to a lot of overdoses. And I could speak to several cases where where fentanyl was put into cocaine, and a lot of people died in a very short period of time. And so, the Black population, historically hasn't been the most afflicted by the opioids, but now that fentanyl started getting into these other substances, um, again, when someone is in comes out of treatment, their tolerance goes down. When someone is incarcerated, their tolerance goes down. If they relapse and go back to using um, drugs again, then they're at risk. And if you look at people who have no tolerance for opioids, and again, they're called poisonings. And again, they're really getting poisoned. So again, that's an anecdote. I can't speak to hard data on that, but that's definitely part of the dynamic there. That
Yeah.
fentanyl just kind of proliferated the drug environment pretty good.
That's no, thanks for sharing that. And just any final thoughts to leave, anything that you would identify as the top concern going into 2026?
So, you know, historically, the country goes through phases of stimulants and depressants, stimulants and depressants, and so it looks like we're transitioning out of that. Um, Depressants and stimulants are on the rise. I just think that continuing education and prevention and understanding the dangers that are out there, and just keep pushing on helping people that need help, and really doing a lot of good prevention work and education work, so that people aren't at risk. That's really all I have. The drugs out there now, I think it's important to know, the poly drugs that are out there now, people don't really know what they're getting, whether it's in pills, whether it's in powders. And again, we talked about, cocaine being adulterated sometimes. And the methamphetamine market's rising pretty dramatically. So again, I think, you know, let's try and be one or two steps ahead of this, and not get caught by it, and understand that, the changing trends right now and the changing patterns, and what we can do to mitigate that.
No, thanks so much. I know we're at the end of our time. Again, I want to thank you for a great, really informative presentation and for your time with us today. I want to thank all of our attendees for joining us today. Information on how to access continuing education credits are on the screen, and I hope that you will all join us in January, on January 29th, as we look at and do a deeper dive into opioids and synthetics and what we need to know. We're going to have Dr. Lewis Nelson, formerly of New Jersey, who will be joining us for that presentation, and hoping that you can all be with us. So thanks so much for joining us, and wish everyone great rest of December and into the new year. So have a great day, everybody.